We do close to 6,000 cases, including 3,000 coronary cases in a year and almost 1,200 coronary interventions. Peter, who as a nurse, what were you experiencing and what were your main constraints before we got ACIST?
When I heard that we were getting the ACIST, I was like, what is this? How is this going to change? Because efficiency is important to me, it's important to our team. And I initially was like, oh man, is this another thing that's going to slow us down, make our lives harder? And I wasn't really too happy about it. I thought, oh, the manifold, this is perfect, right? There's nothing wrong with the manifold. But it took about a month of us using it, and I was like, okay, I get it. It's really not that hard. I thought that it was going to be a big issue, that we were kind of moving this heavy equipment and manipulating all that stuff. It really wasn't that bad. So from an efficiency standpoint, we have really pushed the boundaries of what you can do in a relatively small lab.
Yeah, just like any other new technology, there is always apprehension when you start. But I think I agree with you. It helps us a lot in our day-to-day schedules and going through the cases. Morgan, as a technologist, what are your concerns regarding accepting new technology?
I think a lot of it was just the initial change of your everyday routine. You have, you're expecting, okay, I know how to set up manifold, I can do this at the table, but you're having, with the ACIST, you set up beforehand, which can actually eliminate a lot of time at the table. If you have an emergent case coming up, then you can have that set and you can have that ready. And the patient comes up and then it's just a quick couple buttons you're pushing, hooking up here, and you're ready to go, versus handing off for a manifold that just took more time for like emergent.
So it's counterintuitive, but setting up the ACIST actually saves time.
Right, I think,
which we realized later on, because one thing you're used to doing manifold, which we have been doing for a long time.
Right.
It's difficult for a change.
And I think I'm new enough to the lab too, so having new equipment is just something that is constantly happening in the cath lab. You're just always being introduced with new stuff. So being newer to the lab, I was open to it. As for Peter, you've worked in the lab for years, so it's like a new thing to change your dynamic is such a big shift. But yeah, I think initially it was like, oh, I don't really know what this is about. Let's find out. So I had a little bit of excitement with that, but and it's been pretty easy to pick up and teach. It's quick to learn for everybody.
I think everyone's really taken it to it really well. No one has been like, I can't get this. This is too difficult. It has a really easy to read display. As long as you follow the prompts, you're going to do okay. I think when we train people, we make sure that they're comfortable with the equipment before they have to get thrown into an emergency. And that's kind of the nice thing about the ACIST, is you set it up when nobody's in the room, when there's no pressure, when there's nothing going on, and you can take your time to read through and look, am I doing this correctly? So just having that available on your time makes it easy to train on, for sure.
The nice thing about the ACIST is, like Peter was saying, it's just there's all these prompts here, and as I was saying before, it's just you can kind of get that set up before the patient's in the room. I think it's pretty easy to get off. It is a heavy machine, but once you get in the habit, you do it a few times, just like it is setting it up. Everything new that you have to learn, it's always kind of at first, and then you find comfort in it, and it's not too bad. Another nice perk I think I like a lot about it too is when you do an LV injection, we don't have to set up a whole other injector. Everything is just here. We flip the parameters and we're ready to go with a whole injection. It saves time. It really saves time.
It's a lot easier, yeah. The other thing I like it for is the ease of use. I do a significant amount of radial cases, as our lab does, and when you're doing a radial, and people who do radial with a single catheter, they have, sometimes it's difficult to engage and keep the catheter at the same location. And when you have a manifold, you're trying to engage and you have to take your hand off and then open the manifold and inject with the other hand. And by the time you realize that the catheter is flipped out of the corners. So with this ACIST, you can keep your hand on the catheter, so it's not really moving while you're injecting with the other hand. So I think that has helped me a lot in going through my radial cases quickly. And also, to a certain extent, although it's not a big deal, injecting the manifold 10,000 times in a month is eventually going to wear off my hand, and not having to do so with a push of a button, it helps me a lot. So I think I've realized that it is a convenience factor too for me, as well as it's a safer thing for the patient.
One of the nice things that I've seen that they've asked you guys to do at the table is as they're torquing and trying to hold this catheter in place, they ask you to hit the button, which is much easier than picking up the manifold and going through the progressions and checkdowns. So I think you could speak to that, how that has affected your...
Yeah, I mean, it's easy for us if physicians just, don't want to take their hand off the catheter. They can just turn to us and say, hey, can you give me a little puff here? And it's, also just easy for us to use that. And no flipping of the, turning of the manifold valve there. And those that might not be educated might not know how to do that, and it just leads to a whole other thing. So it's just a very easy push.
It's easier than I thought it was going to be. We have a lot of diverse patients, and we have a lot of different doctors. We're not always doing cardiac caths. We're sometimes doing interventional radiology procedures. So that was a big concern of mine. And it really has made a good, positive change in our lab.